So I'll be talking on this topic, which I had as a pro-con debate in Mysore South Zone Conference in 2018. So my opponent was Dr. M. N. Shivkumar. So this was the debate I had. So he spoke on the topic that he will not de-escalate antibiotics in culture negative sepsis. So my rebuttal was that I will de-escalate antibiotics in culture negative sepsis. So the debate agenda was we'll cover a bit on the background. So let's get the basics right. So what do we understand about this whole antibiotic and its de-escalation? And we look into the available evidence to de-escalate antibiotics in sepsis and septic shock. There are two studies. In neutropenic sepsis, there is one study, and there is one meta-analysis where they have looked into the outcomes of patients where antibiotics were de-escalated in culture negative sepsis. Then we'll touch about procalcitonin as an adjunct to de-escalate. So there were two studies, take home message and rebuttal. So when you look at the background, I think what we need to understand is it is extremely important to optimize our usage of antibiotics. The reason why it is extremely important is because there is growing resistance of or resistance of organisms to infections, and there are no new antibiotics in the pipeline. And what literature has shown is 30 to 60% of antibiotic usage we do is unnecessary, and 30 to 60% of the time we use inappropriate antibiotics, and 30 to 60% of the time we use suboptimal dosage of antibiotics, and all these together leads to a worsening of antibiotic resistance. And the inappropriate and usage of antibiotics is due to increased prescription of antibiotics by anyone and everyone, and erroneous prescription of antibiotics. And these are the references for that. If you look at the epidemiological data, it is shown that there is increase in the emergence of antibiotic resistance, and the usage of increase in the usage of antibiotics is shown to have direct proportion to the emergence and dissemination of resistant organisms. So the more antibiotic we use, the more is the emergence of resistant organisms, and more is the dissemination of resistant organisms. So the topic for the debate is that I will de-escalate antibiotics in culture negative sepsis. So then we need to understand what is the definition of sepsis. So again I show this figure. So sepsis is